right, now that we have a new president and we're days away from a new year, how about a new you? Dr. Bill Johnson of Innovations Med Spa has a scoop on exciting procedures that can transform your shape. How are you this morning?
Good morning.
We are all listening very attentively to this because some things just aren't where they used to be.
Some things aren't, that's right. And what we're going to talk about this morning is fat transfer, which is not really a new technology, but has really developed to a point that it's reached a real usefulness.
Okay.
So we can move fat from somewhere that you don't want it to somewhere that you'd like it.
Yeah.
We can do it in the office under a mild sedative and local anesthetic. We do a 1/4 of an inch little tiny incision, and you can be back to work in a day or two.
And you can smooth out those dimples. I mean, they're cute when they're on your face, not so cute when they're in other places.
That's one of the big applications of this, is to be able to smooth out dimples and divots in legs, thighs in particular.
Dimples and divots. They don't belong on the legs.
No, that's not our favorite place for them. It's sure not.
All right. So how are we accomplishing this?
Well, what we do is we take the fat from one area and put it in another. And one of the more favorite places is the buttocks.
Yes.
And when we do the buttocks, we call it a Brazilian lift.
Okay. Because we're lifting.
We put the fat in on the top part of the buttocks, and this is an animation to kind of show. And we typically will take the fat off the thighs or from around the waist, so we get, at the same time, we're getting some lifting and fullness of the buttocks. We also see decreased thigh size and decreased waist size because that's where we took the fat from.
Oh, I see.
Okay, and so we see both the lift, more fullness in the buttocks, and a narrower waist. So overall, a much better look.
Now, what I'm thinking about is when your tush kind of leans downward, and where half of it ends up somewhere in the middle of your thigh.
I understand, yes. And that's really where this really has a great application, because we really can get a lot of the fullness and a lot of the lifting back, and we can do it using your own fat.
Okay, all right.
Same thing applies to breasts, because a lot of women that have had pregnancies, especially, will lose a lot of the fullness and get some sagging.
Right.
And so it's the same thing. We can take the fat from elsewhere.
Really, like from my bottom.
Correct.
Put it up to the top.
Put it up to the top.
I'm liking this.
And get the lift back, get the fullness back that was lost after pregnancy. Now, it's not, it's not a technology to take you from an A to a D cup.
Okay.
But it is a great technology to get you back where you were.
To fill out the cup.
To fill out the cup where you were before pregnancy or before a lot of weight loss.
That's right. Or when you lean down, there's just not this, it looks like the sock.
That's right.
Sock effect.
That's right.
All right.
Now, one of the other things we talk about, we've got the Play-Doh here to show it, is fat shifting. So when we have a groove that's around, in an area of fat, like typically on the thighs or on the buttocks, we can actually take a catheter and we free up the fat in the area. And then this is actually one of my surgical tools that I use. Okay. And we just smooth the fat out.
It gets rid of all those dimples and divots.
And we can get rid of the dimples and the divots very naturally. And the advantage of this is the fat already has its blood supply present.
I got it.
So it survives very nicely. So once we've actually done the smoothing, we have a very long-lasting, enduring result.
Very quickly, let's go through some before and after pictures. Also, you can do this on the face where you've seen some hollowing there.
The face is where this originally started, and it's really exciting. And that's where the technology's been developed to actually plant the cells individually. So you can see how filling in the cheeks and around the chin really has helped with this lady on letting her look younger. There are a couple of recent studies that have shown that having lost facial fat is the thing we associate most with aging.
That's right, that's right. You see that hollowed face. And why haven't we heard more about this?
It's because the fat historically has not had a great survival rate. Nowadays we can get up to about 70% of the cells surviving, so we have a really enduring really permanent results.
So don't be fooled by the fat that I've got. It can be used in special areas.
That's
Good
right.
to see you. Innovations Med Spa has locations in Dallas, Grapevine, and in Fort Worth. You can learn more about these and other beauty on the run procedures for the face and body by calling 972-331-8844 or log on to innovationsmedspa.com. If you have a question for Dr. Bill Johnson, drop him an email at questions@innovationsmedspa.com.